There are a number of challenges that we need to fix. First and foremost, as we see it, the frontline workers are, to a large extent, the backbone of the healthcare system. And there needs to be a system that enables them to continue their professional development, their professional growth, and enables them to continue to move up the career path. Getting an understanding of that and building a system to support that has really been our key initiative and our key challenge. And I think the good news from that is that we have built a system with our educational partners and our employers, because it's key to note that our employers have been very receptive to developing their workforce. So with employer partners and our educational partners, we have been able to build an educational and career development system that starts in the workplace and supports them through community college and ultimately a four-year institution. Capital Workforce Partners is committed to continuing this work beyond the life of the grants, because we do this work not because we have grant funds to do this, but because we believe it makes sense and adds value to the allied health sector. There are a number of challenges, and as we started this initiative, our focus was really looking at how we enable frontline workers to continue their developmental path so that they can ultimately move on and satisfy the needs for nurses and other allied health technicians that are desperately needed, at least at the time that this initiative started. But as the system is evolving, where the most significant need is around the community care area, and thinking about how we position our current workers who primarily support institutional care, how we enable them to have the skills to transition themselves towards community-based care. That's the challenge that confronts us.
Because of my job training, I have gone on to the college level. I just completed my first college course, and I'm on my way to obtaining a degree.
The biggest asset is that the courses take place at Manchester Hospital, where I work. I leave the floor, go down and take my class, and then I'm free to go.
I was taking a dementia course in order to better understand my residents. One in particular, I learned that you don't just see things from the outside and get people to come into our world, people with dementia. What you have to do is somehow find a way to read between the lines and enter their world. It really makes a difference to be able to reach someone. It really does. It means the world to me.
I'd like to take this opportunity to first thank Capital Workforce Partners for providing Southington Care Center with this educational grants over the past 4 years. This initiative has provided my staff with a very unique and wonderful opportunity to further their education and to build self-confidence in the workplace. It can be very difficult to participate in classes when you work full-time and have a family to take care of at home. Over 60 staff members at Southington Care Center have participated in various classes that have been offered, and the benefits of these classes have become quite apparent and evident at Southington Care Center. Staff members are more empowered and knowledgeable. There's been more teamwork out on the units, and perhaps the most important benefit from these classes is that our residents are being cared for by quality, educated staff members.
All of these things help the employee to feel much better about themselves, what they do every day when they come to work. They feel good about who they are, and they feel good about the services that they're providing and the care that they're giving to our residents.
I can't say enough, and I encourage my staff, and a lot of them have participated, and a lot of them have learned a lot from these classes.
And then the last, as a rule, we have exceptional people. Our CNAs are exceptional, but after they took these courses, they were even better.
Much of our education, high-level education, focused on nurses, and this really gave us an opportunity to focus on a different group, nursing assistants, secretaries, and techs, and a very motivated, hard-working group. They're really the backbone of our organization, and through this program we really were able to give them higher-level education.
Job training has helped my employees. They are more knowledgeable, and when they're in the field, especially the diagnosis that they've studied, when they come back to me,
they're able to call me and tell me, Aldine, I see so-and-so, and I think this is what is happening. And they feel really good about themselves, and usually they're pretty right.
Quality of care has greatly improved as a result of the training that the frontline workers have received. Quality of life has been greatly improved because the individuals who have participated in this project have improved their skills, have improved their abilities, and have now positioned themselves to improve their wages and professional growth. Capital Workforce Partners strongly believes in building the talent of the workforce. In the allied health sector, and particularly with CNAs, they receive a modest amount of training and are placed into jobs without having the full breadth of training and education that they need to not only do that CNA job, but also enable them to be on a career path to continue their growth. We do this work because we realize that the job is not done by merely placing them into a job, but enabling them and equipping them and building systems to support their career development. We hope you will join us in fulfilling our mission and vision to improve the quality of care and the quality of life for healthcare workers in our region.